Welcome to HotDog Patient Warming. This video will guide you through setting up and using our innovative system to ensure optimal patient care. Start by plugging the power cable securely into the back of the controller. To attach the controller to an IV pole, first slide the power cable into the IV pole clamp. Secure the clamp to the controller using the provided screws. Finally, attach the clamp to the IV pole. To power on the controller, use the switch located at the bottom rear of the controller. The WC77 temperature management controller powers up to 4 blankets and 1 mattress simultaneously, offering unmatched versatility. Place the warming mattress plus return electrode on the operating table, ensuring the cable is positioned at the head end of the table. If you are planning to image in the area of the heart, rotate the mattress before the patient arrives so that the sensor is lower on the patient and outside of the image field. The mattress overlay can be secured to the OR table with the included straps. Inspect the mattress for any damage and check the expiry date on the cable prior to use. Do not use damaged or expired devices. Place a thin barrier over the entire surface of the warming mattress. If the barrier is too thick, it can impede heat transfer and diminish the surgical effect if using HotDog's grounding. To connect the warming mattress to the controller, first connect the mattress to the A112 blue cable. Then, plug the blue cable into the M port. Once the mattress is connected, use the touchscreen to activate warming. If you are also using grounding, first connect the green A136 grounding cable to the mattress. Then, plug the green cable into your ESU. Some generators may require an A138 adapter. Ask your sales representative if this adapter is needed for your model of generator. If using 2 generators simultaneously, use the A137 dual generator Y cable. Be sure to use 2 A138 adapters if needed. Make sure that the cables are pushed in all the way to ensure a good connection. Some generators offer the choice between dual plate or single plate return electrode. If given this choice, you should select the single plate option, which does not require the A138 adapter. HotDog is compatible with many electrosurgical generators. To use a warming blanket, ensure the patient is in contact with the warming blanket sensor. This allows the blanket to effectively warm the patient. Before positioning a warming blanket on the patient, place a thin barrier such as a thin bed sheet or patient gown over the patient. This is to avoid skin contact with any residual cleaning chemicals. If the barrier is too thick, it will prevent heat transfer. When positioning blankets on a patient, ensure that the cables are leading away from the surgical site. Warming blankets can maintain their position without securement. Always check the expiration date located on the blanket cable before use. Ensure the patient is in contact with the warming blanket sensor. To connect a warming blanket to the controller, first connect the blanket to the yellow cable, then plug the yellow cable into any port, A through D, on the controller. Blanket temperature settings range from 37 degrees Celsius to 43 degrees Celsius, with preset modes: all high, 43 degrees Celsius, medium, 40 degrees Celsius, low, 37 degrees Celsius, and off or adjustments in 1 degree Celsius increments. The B500 universal warming blanket has formable edges to hold its position. If the B500 is too large for the contact surface, you can fold it back on itself, purple side to purple side, so that the cable faces away from the surgical site. You can connect B500s together using the buttons and loop connectors located on the sides of the blanket. The controller has a touchscreen interface for an easy-to-use experience. HotDog's flexible warming blankets and mattress can be used during all your procedures. For other blanket positions, the positioning guide is available for additional assistance. Slideshows are available for introductory system training. Devices must be disconnected from the controller to view the slideshows. To perform a self-diagnostic test, navigate to the Settings menu. In the event of an unsuccessful test, please contact customer support for assistance. If an error occurs, the controller screen will display the relevant alarm code and steps to resolve the issue. If the issue persists after troubleshooting, please contact customer support. For all definitions and instructions, refer to the Error Info menu or IFU. There are cable retention loops on the sides of the controller to help consolidate excess cable. The IV pole clamp allows you to attach an optional A110 storage rack to store blankets when not in use. Remember the acronym BEST for the 4 things to keep in mind for optimal outcomes with HotDog. Body surface area. Warm as much surface area as possible for maximum heat transfer. Early start. Start warming as soon as the patient arrives in the OR. Sensor contact. Ensure that the sensor is in contact with the patient. Thin barrier. Use the thinnest barrier possible between the patient and the warming blanket and mattress. It's quick and easy to clean and disinfect warming devices. Wipe the surface with a damp cloth and avoid immersing in liquids. Apply an approved disinfectant according to the manufacturer's instructions. Do not use hydrogen peroxide-based solutions to prevent damage to internal components. Ensure the device is completely dry before reuse. A blanket and mattress can be cleaned in under a minute. The full instructions for use can be found on our website. Thanks for trusting air-free HotDog patient warming to improve your normothermic outcomes.